Yes, actually, I just wanted to also reiterate or stress again how important, how critical is data privacy and security issues, specifically in healthcare. And it is probably enough to mention that in the past decade or so, while we're following digital health news, it's almost on such a regular basis, like almost once or a few times per month, or at least once per week, that we learn of major data breach.
Georgi Chaltikyan. Yes, that's right.
So that's good, yeah. And so it was so interesting. I just wanted to have a little chit chat with him. So, doctor, thank you for taking your time and talking to us.
Thank you for having me.
So technology is going rapidly. How do you, doctor, keep up with it?
Well, it's a very good question. Indeed, the pace of development of technology, of medical technology, and especially we're speaking here at this panel, we spoke about digital health technology, which basically means all the variety of digital electronic information communication technologies that can be used in medicine and in healthcare domain. And the advances there, the pace of advance has been just incredible, just in like elsewhere in digital technology. If we remember that the first iPhone appeared just little longer than 10 years ago, or basically, to be correct, 12 years ago, and today. And to think about what you can do with iPhone today. So the same basically applies to healthcare and to medicine. Speaking about iPhone, and this is one big part of digital health technology that we, the whole digital health community and the experts are currently focusing on. And this has been dubbed mHealth or mobile health. And basically that's everything that you can do with the use of mostly your smartphone or tablet. And there's a whole lot of different things that you can do with that. I'll give you just a small example. There is plenty of devices, sensor devices. We call them wearables frequently because they can be worn on the body or near the body, and they can record the different parameters, physiological parameters of the body, such as temperature, for example, or the amount of oxygen in your blood, or the electronic, or the electrocardiogram, basically the voltage of the heart, and many more different parameters that can all be communicated by the sensor that you wear, that can be as simple as a ring, or as complicated or relatively complicated as something which is embedded in cloths, the so-called smart cloths, or attached to the body. And now all these sensors, they communicate with each other and via your smartphone with the server, with a special server where all that data can be accumulated, stored, and then used to augment, to improve the health of that particular person. And that's what we primarily mean when we say mHealth or mobile health or digital health technologies, because they are rapidly spreading now basically to the consumers. Consumers are now, and the area is also very much consumer driven.
Now, even now, it's no longer the doctors really touch your body when even you go to a physician, is they rely mostly on technology, like send you blood test or CT scan or MRI. And so it's gone this old day, they pick on your belly stuff.
I wouldn't say it's completely gone, not yet, because there are some areas in diagnostics, in clinical medicine, where doctors still rely on the so-called physical investigation. What we basically do, what doctors do with their hands, with their ears, or some smaller devices, and we do still depend on information that we collect from the patients. So it's not yet there, but you're absolutely right. The trend is there is definitely a definite trend of relying more on diagnostic technology, including modern and information communication technology than it used to be, let's say, even a few decades ago.
But how do you, doctor, keep up with technologies on top of your everyday medical, learning or keeping up?
That's a very good question. It's actually a bit of a complicated question, I would say, and there is definitely challenges. There are challenges, significant challenges for the doctors, like you said, to keep up with the technology. And we even know it has been observed and even researched that it depends also on the generation. The more the younger generations of physicians, of doctors, are currently somewhat easier to pick up that technology, just like younger generations of consumers are also easier to pick up the technology. And this is why we digital health specialists, we always stress the importance of making that technology inclusive rather than exclusive, to avoid the so-called digital divide. But a lot of things eventually depend, of course, on availability of training, education, including for physicians, as for the general consumers, for the general population, because people need to learn how to use the technology. And on the other hand, technology must also become more and more user-friendly, easier to use. Because that has been a problem as well with the technology. I'll give you one very short example. When in the United States, in the past 10 years, the American federal government basically invested up to 36 billion USD in different healthcare that went to different healthcare providers to incentivize them and to help them adopt health information technology. Now, some of that technology has not been so user-friendly and so good to use, and that generated quite a lot of frustration by physicians, where they were asked, a backfire, because they were essentially frequently forced to adopt that software, and some of them were complaining that every now and then they figured out that their conversation with a patient is all of a sudden turning into working with keyboard on the computer, because you need to enter all that data into the electronic medical record.
But every time I go to doctor, they spend more time entering the data and talking to me.
Then talking to you, and this is another problem that must be overcome, of course.
Yeah.
I mean, there are definitely quite many challenges, but like with any technology, we are hopeful, I'm personally hopeful, optimistic, that with prudent approach, cautious approach and excellent research, it must be possible, as it used to be in other areas of technology, to find a good balance between the benefits, to be able to tap some of the very important benefits and opportunities that lie with digital health technology, and at the same time to avoid or to minimize at least very significant risks.
Now, two questions. One is, what is your expertise? Second question is, if I was an Armenian, I want to live in Armenia, how is their healthcare standard compared to, say, US, Germany, England? First, your expertise.
Yes, I am actually, I was born and raised in Armenia, obviously in Yerevan. I was trained as physician and surgeon, and I practiced for nearly 20 years clinical medicine, clinical practice, clinical surgery, also medical education and research, and I have also some experience in healthcare management. In addition to that, nearly 10 years ago, together with my colleagues, friends, from both medical and IT industry, we became very interested and enthusiastic about tapping information communication technologies for healthcare. So we founded the Armenian Association of Telemedicine and started basically exploring how we can engage different stakeholders in Armenia and promote usage or spread the word at least about the availability of digital health technologies, information communication technologies. So I would say my primary area of expertise, of course, is medicine and medical education and research. And my second sort of specialty, which has become now my first specialty, is digital health, because I have gone through additional education and training in digital health, and for the past 5 years or so I have been also teaching. In the past 4 years I have been in digital health academia, essentially. I'm working as professor of digital health at the University of Applied Sciences in Deggendorf in southern Germany.
Oh.
So that would be, I would say right now that I consider myself, or I position myself mostly as expert on digital health.
You picked up the right things. Okay, how about Armenian health industry? How you...
Well, the healthcare system in Armenia definitely has gone through very, very difficult and very challenging times after the dissolution, breakdown of the Soviet Union, and with near complete collapse of all the public systems. And some people might know that before that, in the Soviet Union, there used to be a completely public healthcare system. So Armenia has gone, just like many other Eastern European countries or former Soviet Union countries, through this very difficult time, transition period from Soviet style, mostly public or exclusively public and mostly regulated top-down system that had a lot of inefficiencies, to a dynamic system or a more complex system that incorporates both public healthcare or public insurance, pretty much similar to, let's say...
Do they have insurance here?
We have a public insurance or public program, which is, in essence, one may say, similar to Medicare or Medicaid. It covers some services for vulnerable people, vulnerable populations, such as disabled, for the veterans, for example, military, children, and some other categories. So for them, pretty much of healthcare is covered by that public system. On the other hand, there are also some emergency or life-threatening conditions, such as stroke or a heart attack or major trauma, bleeding, and so on and so forth, which are also covered by public system for everyone. So there is some coverage of some conditions for everyone.
There is no universal coverage.
But there is no universal coverage so far in Armenia. However, our government and our Minister of Health has basically proclaimed that the country, and it is an ongoing policy basically, the country is moving.
But they came out with some stupid idea. The people who are from 0 to 18 is covered, but the rest they have to pay. I mean, those are healthy people, you know. You don't have to worry about those. You have to worry about people from 40 or 50 and above, you know.
There is a very important question in public insurances. Public insurances, they work on the principle of solidarity. It's quite different from from the US style private health insurance. Private health insurances are basically based on the so-called risk equivalence. So if I am, let's say, 60 plus and I have a number of chronic conditions, the insurer in the US, private insurer, would be charging me much higher premium compared to a young and fit individual, right? Now, public insurances, they work in a completely different way.
Well,
it's a right. Well, Medicare is basically, it's not an insurance per se, because it's directly funded by the government, right? And the public insurance, they work the following way. The rich and healthy subsidize sick and poor. You know what I mean? Because it's income-based, like in Germany, for example.
Canada.
It is Canada, similar to that. All the public systems, they work basically more or less like that. Or UK, it's tax-based. So you pay your tax. You're rich, you pay much more into that general fund of healthcare system than somebody who is doing less well. And even if you are very young and fit and you don't use those resources, those who require care, they receive care even if they are much, much less wealthy. That is the principle of any public insurance, and it works only on the basis of mandate, if it is mandatory, because everybody must participate, otherwise it doesn't work.
Because I got lots of time, people who have, say, cancer or something, they want donation to send the kid or the person to Germany or other places, is because those services not available in Armenia?
Partly yes, because there are, of course, the scope of services that are available in our healthcare system is expanding. I would say, it is definitely not, it would not be an exaggeration to say that the system itself is growing more robust, safer and better, especially in the past few years. However, there are still some services that either are not readily available to population of the Republic of Armenia, or more frequently where large internationally renowned institutions have or are perceived and in fact do have better expertise in treating those conditions, especially when we're speaking about some complex conditions, because it very much depends on the experience, basically on the amount of patients that hospital has seen. And it should not be a surprise that a huge university hospital somewhere in a big town in a European country, let's say in Germany, definitely sees many more, let's say, complex patients per period of time than, for example, a hospital in Armenia, simply because of the sheer volume of the population. And also, of course, our health system is currently, I would say, in the phase of maturation. We're still developing. We do have, and we have had amazing, fantastic doctors. The technology has been a little bit less, and the management has also been a challenge. But the human capital, the workforce, excellent workforce, is there. So it depends on. It requires a little bit more effort to put all that on a good ground.
So, a little bit politically question.
All right.
What mark you give?
Politics.
No, but from progressive, what mark would you give to this health minister? Because he has come out with some program stuff like that, 0 being bad and 10 being good. What mark you give him?
Current health minister, you mean? Well, actually, I think he has been doing quite well so far, overall, in terms of introducing, some programs or expanding the public coverage and making it more readily available to the population. There have been some controversies regarding his presenting the coverage as expanding. And for example, telling the patients that from now on you can be treated or you can be operated on for free at a hospital X, Y, and Z, which sometimes caused some degree of, I would say, it was not always appreciated by the specialists working in those hospitals because of sometimes mismatch between the funds that the public system, the government, is able to give. It's about the money. But however, I have to say that this is not an unusual situation, and it's nothing unique to Armenia. As long as there are authorities and healthcare managers regulating public system on the one hand, and physicians, especially private physicians, on the other hand, there is always conflict of interest because the government, the system, always tends or wants to pay doctors less. This is absolutely natural, right? Because you have just a fixed or limited amount of money, and you must make sure that that money is enough for all. While individual doctors, they have their point of view, and it can be also easily understood because they say we invested, years of training. We invested frequently also very significant amounts of money into becoming top-level specialists. Not to say about a very significant mental and physical, but most importantly, mental or ethical challenge of
It's very complex, the healthcare system.
oh, it is terribly complex.
Very complex.
If anyone is to ask you whether or not you know a country or a nation that has nearly perfectly working healthcare system without major difficulties, major challenges, and frequently major problems, just go ahead and say such countries non-existent.
Yeah, I agree with you. So, should I move to Armenia, not worry about healthcare?
Absolutely. I can guarantee that.
Thank you very much. I wish you all the best.